Anemia in pregnancy, it is the commonest medical disorder of pregnancy. What are the physiological changes that are occur in pregnancy? Plasma volume is increased by 50%, red blood cells mass increased by 25%, fall in hemoglobin concentration and the hematocrit level due to the hemodilution effect that occur in the pregnancy. MCV also increased due to the erythropoiesis. MC, HC remain normal. Serum iron and the ferritin level was decreased, but TIBC is increased. Increased demand of the iron, increase iron absorption, and also increase the folate requirement. When the hemoglobin concentration fall below the 11 gram per deciliter in pregnancy, then we diagnose as the anemia. Incidence 30 to 50% pregnant women are having the anemia at pregnancy. 90% have the iron deficiency, 5% have the folate deficiency. Clinical features. What are the symptoms that present patient with anemia? Patient have the complaint of the tiredness, dizziness, fainting, pallor. How will you will diagnose? We will diagnose it during the booking visit. Just we send CBC at the beginning of the pregnancy. It is a cheap and simple. Iron deficiency anemia. What are the findings on the peripheral smear? It is a microcytic hypochromic in which the MCV and the MCHC both are reduced. Causes: increased demand in pregnancy due to the expanding red blood cells mass. Fetal requirement is also increased. If the iron stores are depleted because of the menstruation, it may be due to the recurrent pregnancy, poor intake, malnutrition. What causes anemia in pregnant women? It may cause the preterm labor, infection, medical intervention during the labor. It causes the postpartum hemorrhage and intrauterine growth restrictions. How will you treat the patient of anemia? You will give the oral supplement. After giving the oral supplement, the hemoglobin increase 0.8 gram per deciliter per week. The side effect depend upon the amount of the elemental iron. Choice depend on the cost and the patient tolerance. Vitamin C also help the absorption of the iron. What are the main side effect of the oral iron? It causes the GIT upset and the constipation. Indication for the parental iron: when patient is non-compliant, are having the severe GI upset or malabsorption. What are the form of the intramuscular iron? Iron sorbitol, but it was painful and causes discoloration of the skin. High level may be excreted before utilization. IV iron secrete may cause the more rapid rise in hemoglobin, but also have the side effect which are less than the oral iron. The most rapid way to increase the HP is the blood transfusion. When there is no time to correct the anemia, especially during the placenta previa, our patient present at the term with the anemia, so we just transfuse the blood. It may have the transfusion reaction, allergy, transmission of the infection is also increase in the blood after blood transfusion. Prevention is possible with a good balanced diet, spacing during pregnancy,